Hello everyone, I'm Dr. Lim from KB Lim Skin Clinic. Today I'm going to talk about acne rosacea or rosacea for short. Rosacea causes acne-like papules or bumps or pusheads known as pustules on the background of erythema or red-looking skin, often as in association you see telangiectasias, which are broken capillaries, and these patients often give a history of facial flushing, especially when exposed to heat. And unlike patients with acne vulgaris or acne, which affects teenagers and very young adults, rosacea usually affects the older individual, usually between the ages of 30 to 50. The causes include an inherited vascular reactivity. It's also been proposed that Demodex follicularum, a mite that lives in the hair follicle, may be involved in the causation of acne rosacea, and also production of pro-inflammatory chemicals known as cathelicidins and matrix metalloproteinases. There are several different types of rosacea. The most common type is known as papulopustular rosacea, or also known as inflammatory rosacea. And then there's another form known as erythematotelangiectatic rosacea, which is known as vascular rosacea. This causes a very intense redness of the skin due to the vascular reactivity of the skin. A third type is phimosis rosacea, which usually causes craggy enlargement of the nose. Phimosis rosacea. And another form of rosacea which affects the eyes, and that is known as ocular rosacea. There are other variants of rosacea which are less common, such as granulomatous rosacea, rosacea fulminans, or Morbihan disease, which is a edematous form of rosacea. So here you see a patient with papulopustular rosacea. Note the inflamed papules or bumps and some of the pusheads, and note that this individual is older. She's not your average teenage acne patient. So rosacea occurs in the older age group. Here you see a patient with telangiectasias. These are small capillaries that show through the skin. This patient happens to have telangiectasia used to chronic photo aging due to sun exposure. But the same can occur in patients with rosacea. This can also occur in patients who have thinning of the skin due to overuse of topical or steroid creams. They have a similar appearance because they are all telangiectasias or small capillaries. Rosacea, as mentioned earlier, causes flushing of the face, and here you can see the very intense erythema or the intense redness, and these patients are often very disturbed by this, and they also have symptoms such as burning and stinging when it happens, and they're very, very disturbed and unhappy over the condition of the skin. So now there are many factors that can aggravate rosacea. One is ingestion of alcohol, hot fluids, anything that's hot temperature or spicy will make it melasma worse. Anything extremes, heat, cold, hot bath, saunas, and so on. Vigorous exercise, anything that increases blood flow, vigorous exercises is going to cause rosacea to get worse because the flushing gets worse. And in drugs that dilates the blood vessels, either to improve circulation or to reduce high blood pressure, will do the same, will aggravate it. And as mentioned, topical steroids on the face can aggravate it, And a form of rosacea caused by steroid is called steroid rosacea, and we see this in patients who use steroids for treatment of minor skin problems, sometimes in the treatment of melasma as well. As a person reaches menopause, rosacea becomes more common, so it has a hormonal cause as well. And emotions of any sort, stress, anger, embarrassment, will often make rosacea worse. So, what are the treatments available for rosacea? Oral treatments, which usually comprise of antibiotics such as tetracyclines or erythromycin, or the use of isotretinoin, which is a retinoid or vitamin A derivative, is also known as by the brand name Roaccutane, which is also used for the treatment of acne. It also helps acne rosacea. Often, treatment is topical treatments is usually used in combination with the oral treatment above, and they also work by reducing inflammation. Some of the agents used include metronidazole, a type of antibiotic, and it works because it also helps to eradicate the follicular mite that I mentioned earlier on. Azelaic acid, which is also a treatment that's used in acne, can also help rosacea, and so can ivermectin cream as well. And the other treatment is aimed at reducing the redness and the flushing, and one of the agents that can be used is brimonidine, um, also known as Mevaso, or a product known as bisabolol, which is actually derived from chamomile tea. There's less data on the use of bisabolol for treatment of redness, but I think it works quite well, and it is safe to use long term. So these are some of the treatments, and very often we combine them to make them more effective. Now, I'm seeing a lot of patients with melasma who complain of redness and flushing. And very often they are on lightening treatments, most commonly um, products that contain potentially irritating chemicals such as tretinoin or hydroquinone that can also cause irritation of the skin, and particularly patients who use the triple combination cream for longer than the recommended 2 months duration. This is because topical steroids can thin the skin, and thin skin will look more red because the capillaries will show up, the blood vessels will be more dilated, so flushing is very common. So in these patients who have melasma and redness and flushing, from some of them from lightening creams, we need to take them off the standard formula that we use. And the problem is the triple combination cream is so effective that a lot of patients are reluctant to stop using them. So in the past we did not have very much alternative. We removed the steroid but continue with the tretinoin and hydroquinone. So this is a double combination cream rather than triple combination cream, because it doesn't contain the third product, steroids, and it is safe for long-term use. The only problem is because it doesn't have steroid, um, patients can get a bit of irritation from the hydroquinone or tretinoin. So in these patients, I tend to put them on tranexamic acid, which is a novel agent in the treatment of melasma, and I have a separate slide, a separate video on this, and I'll provide you with a link to this video on tranexamic acid, a novel agent in the treatment of melasma. It is a good alternative for patients with melasma and redness. The other reason patients with melasma have redness is because some patients with melasma have got telangiectasia, and it is believed that actually telangiectasia may actually drive the melasma as well. So that's why tranexamic acid, which you will learn in the video for which I've provided a link, tranexamic acid, It works by blocking vascular endothelial growth factors, or VEGFs. These factors can be blocked, and then melasma can also be improved. So you improve both the flushing as well as also improve the melasma. But mind you, it is not as effective as hydroquinone, but it is very well tolerated. It rarely ever causes irritation in my hands. I've not encountered a single case. I'm not sure about others, but tranexamic acid applied to the skin is extremely safe, and it can be used long term. So I would encourage you to click on the link and learn more about tranexamic acid in the treatment of melasma. So I hope you found this video useful, and I invite you to visit us at www.kblimskinclinic.com, where you can view more videos and learn about common skin problems and how it can be treated, about lasers and all those different treatments that we have to make the skin look healthier and younger. So goodbye for now, and I hope to see you again.